to all the amazing people watching and listening to this. Welcome to Chezuba Talks, a podcast dedicated to sharing compelling stories of hope, determination, and humanity. Of all the rights of women, the greatest is to be a mother. A miracle is really the only way to describe motherhood and giving birth. Maternal health is crucial for healthy and productive populations. But poor socioeconomic conditions, lack of well-trained healthcare professionals, or proper infrastructure are barriers to accessing medical facilities. In 2004, two Kansas City doctors returned from a medical mission trip to Haiti, realizing that the effect of their visit ended when they left. Dr. Elizabeth Wickstrom and Dr. Stan Schaffer had a vision of providing ongoing services in rural, underserved Haitian communities where high-quality maternal and infant health care was absent. Maison de Naissance, a modern, culturally appropriate maternal center, was established in 2004 in Torbeck, Haiti. And this organization is sponsored by Global Birthing Home Foundation, a 501c3 nonprofit public charity based in Leawood, Kansas. Since its establishment, Maison de Naissance has performed over 8,000 healthy deliveries and conducted more than 350,000 total consultations. Wow, I couldn't read that number. Meet Jim Grant, Executive Director, Global Birthing Home Foundation. Welcome to the show, Jim.
Good morning, and thank you very much. I'm quite happy to be here, and I'm looking forward to telling you all about our organization.
Absolutely.
As you mentioned, we've been in operation for about 18 years. I've been a part of that since 2008, and I consider myself very fortunate to work for this organization. Prior to working for Global Birthing Home Foundation and Maison de Naissance, I spent 20 years in IT, and I realized at some point that I had become disillusioned with my career because I felt that I was working constantly and making a decent income, but without any really socially redeeming qualities attached to any of the efforts I was putting into that. And so I had a chat with my boss at Cisco Systems, and I just asked him point blank, is there anything at all that we do here that's just for the betterment of mankind? Or are we just here to make money for ourselves and the company? And he said, maybe this isn't right for you anymore. And that's when I decided it was time to make a change. And this is where I ended up working in nonprofit. And it's the best job I've ever had.
Wow, well, that is something. That's a story. And you've been working in the IT industry for how long?
I had been in IT for 20 years.
20 years.
And had moved up from being a lowly code writer to being in a upper management position. I had a directorship with the territory that included the entire north central U.S. and Canada. And it just didn't really have anything that was for me personally rewarding about the work at that point. I realized I was just working really as a cog in the corporate machine to make money. And that wasn't satisfying.
You know what, Jim? Have you heard of Chezuba earlier?
No, actually, I was so glad to hear from you and to be presented with this opportunity.
Right. So Chezuba does exactly that, as in to all the people who feel they want to give back to society, Chezuba provides a platform to volunteer online to any nonprofit of their choice. And that's how we have multiple nonprofits, catering to every kind of social need. So yours is global birthing. We have people who are taking care of animals. We have people who are taking care of the homeless, and everybody who's working in the IT industry or any corporate sector and feels like doing something parallelly along with their work. Chezuba provides this opportunity.
Well, I'm so glad you found me.
Well, it's wonderful talking to you. Well, let's get on to talking about your organization. What is the mission and how does it support home birthing?
Our mission is to significantly reduce maternal and infant mortality rates as of now in rural Haitian communities. We hope at some point to expand beyond Haiti, which is why our primary foundation has the rather ambitious name of Global Birthing Home Foundation. We want to use this as a template to open birth centers in other places. As it turns out, though, the need in Haiti has been so great. As we've continued to expand our reach in the region where the birth center was initially founded, we've discovered that we could operate in Haiti for probably several decades before we really could, say, okay, we're meeting the need in general, at least in Haiti, and now we can go somewhere else. So we're staying in Haiti for now just because the need is so great. Where we operate now, there did not used to be any access to professional maternal and infant healthcare services. So a very rural area. Most of the people live by subsistence farming. Oftentimes they don't really have any real cash income, so they couldn't even afford a motorcycle taxi to go into the nearest city for healthcare unless it's an absolute emergency. And the state of the national healthcare system, unfortunately, in Haiti is not very good. As an example that I'll give you, this is why the birth center was actually established where it is. One of the founders was doing a tour of the national health facilities around the country with a group of nurses and medical students. It's Dr. Stan Schaefer. And when they arrived in the town of Lakai, which is the closest to where we operate, they were just preparing to enter this hospital when a woman whose baby had just crowned, she had been in the labor room laboring, but as soon as the baby started to crown, they were throwing her out because her family had not come back to pay the delivery fee. And the doctor wasn't going to touch that baby if he hadn't been paid. And so his team delivered that baby within the next 5 minutes in the parking lot in front of the hospital. And that's when he knew this is where we need to be. This was a woman who didn't live in town. She lived out in the countryside, which is what took them out to Torbeck. And so they established the facility there.
Wow. I mean, that story would have shaken anybody. Imagine the lady and the plight of the baby as well. Well, yeah, absolutely. So your organization, Global Birthing Home Foundation, is providing safe and efficient home birthing, or is it that they have to come to your institute?
Yeah, actually, we do support home births, but it's not preferred. The issue is that traditional birth attendants in Haiti don't normally have any sort of formal training. Oftentimes, they don't have a good understanding of hygiene and sanitation. It's quite common if a mom is bleeding after delivery that they use something, like dried grass to staunch the bleeding. It's because they don't have access to medical supplies. They don't have gauze. They don't have, sterilized instruments or even latex gloves. And so the post-delivery infection rate for home deliveries in Haiti is quite high. And because we work in a rural area, the population density in general is low, but we cover a region with roughly 76,000 inhabitants altogether. And so it's quite spread out, and it really wouldn't be logistically possible for us to have trained birth attendants available to attend all of these far-flung villages and individual subsistence farms. So we do generally expect them to come to the center. And for that purpose, though, we have an ambulance which can go out on call and pick a woman up and bring her to the center if she doesn't have transportation. And we have an incoming phone. I mean, it's dedicated only to incoming calls so that in an emergency, if somebody calls that number, and believe me, everyone in Haiti does have a cell phone.
Yeah.
That's the one
I
thing
mean,
they
who
do
doesn't
have.
now?
They do have. And so they can call that number and we'll immediately dispatch someone to go and pick up the mother to bring her in if there's a
Okay.
problem. Now, we encourage moms to come in any case to deliver their babies. And that starts from the very first time they come in for an appointment, whether they're coming in for family planning, for some sort of other, reproductive health issue. If a woman has an infection that needs to be treated, right away they're told, okay, if you do become pregnant, you should come here and let us take care of you. And we recommend that they come in for at least 5 prenatal care sessions. And throughout that whole process, the mother is encouraged, please come in to deliver your baby, because if something goes wrong, we can manage those difficulties.
Great.
The sad fact is that even today, as long as we've operated in that area, it's such a traditional, such a strong tradition for women to deliver at home with their mother and
Yeah,
family present that they
I
don't
would
like to
think
go to a
so.
hospital.
Right. I would think so. In fact, I was just coming to that. There must be some culturally or traditionally, safe practices that they follow from a long time. And then with you being there, how are you received?
Actually, well, we have a community health promotion group, and they go out into the region around there on sort of a round robin basis. We have 7 people in that group, and they each have their own territory. And as they work their way through their territory over the course of, say, a month or a month and a half, they then go back to the start and go through again. And anytime that they get word of a woman who has recently discovered that she's pregnant, they go immediately to that house to talk to the woman and advise her about things that need to be done to make sure that she has a safe birth and that her baby is, born healthy. And the other thing that we do is we encourage them to come in so that we can prescribe things like prenatal vitamins or treat any issue that they might have up front. If they have any sort of infection that's treated, we help provide them with food supplements to make sure that they stay healthy during their pregnancy and afterwards. It's what we like to think of as a very complete suite of services that we offer to ensure that the mother and her baby will be healthy.
That's wonderful. So pre and post delivery as well. So you're
Right.
catering to kind of every kind of service. So when we are talking about these services, you have a staff that is trained.
We do. We have a 100% Haitian staff, which we think is very important to ensure that everything that is done is culturally appropriate. From the director all the way down to the house cleaners and laundry women, they're all Haitian. They're all hired from the local community as can be, but we don't have any doctors. What we have are midwives. So they have to
Midwives,
be
yeah.
certified midwives, right? We have 6 midwives. We have 8 nurses. The nurses are often trained in some particular specialty, such as testing and treatment of STDs or family planning services, or just general reproductive health. And so that does 2 things. It keeps our operating costs lower than they would be if we had doctors in a surgical facility.
Correct.
But the other
Yes.
thing that it does is it ensures that when a woman comes in to receive treatment, it's not a cold medical atmosphere. We operate it intentionally to be like a home. And in fact, when the building was purchased, it had previously just been a general medical clinic. And we put a new facade on the front with what they call a false front. It looks like it has a roof, a peaked roof instead of a flat roof, because a flat roof means it's institutional care, which Haitians, rural Haitians anyway, don't trust. And so it's not just the building, though. I mean, that appearance helps, but that's just a way of conveying that we want them to feel like they're at home. And that's why we call it a home of birth, too. So they come in and they're welcomed and they're treated with respect. They don't need to be afraid to come in. They don't need to fear somebody who's going to be rough with them or barking orders at them. It's all
Absolutely.
done
And that
in a very
sterile
warm
and
and welcoming environment.
true, true. Sometimes the smell of a particular hospital can also be off-putting.
Yes, yes, absolutely.
Yeah, I know how that feels. Well, so do you also have partner organizations that help you or support you in your efforts?
We do, actually. We have a number of partner organizations. We belong to a network of birthing centers in Haiti. There are probably somewhere between 10 and a dozen spread around the country. And I don't have an exact number because, unfortunately, some of them have not survived the last few years between COVID and all of the unrest that Haiti's been experiencing. A few of
Right,
them
right.
have had to close their doors. But we have an active partnership with other birthing centers in Haiti. We have monthly meetings online and discuss, just what issues we're facing, what's going on in the country, how we can help each other logistically. We tend to share access to resources, whether those are sources of medical supplies and sometimes funding. If one of us finds an organization that funds specifically what we do, and we're successful in receiving support from them, then we pass the word around and let other people know so that
Oh,
they
wonderful.
have access to the same opportunities. And it's incredibly
That's great.
beneficial.
Right, it's mutually beneficial.
Yes, it is. And that type of partnership is what has helped us get through the last two biggest natural disasters in Haiti. One was
There was
Hurricane
a
Matthew 2016,
yes,
and then the earthquake just last year in 2021.
absolutely, yes, yes. And also the political unrest that happened, I think that was
Oh, yes.
2019. That must have been a terrible time.
It was, in fact, it was a terrible time. Well, in 2019, and then again in 2021 when the president was assassinated, and now with the rise of gangs in Port-au-Prince, the capital city, who now control, they estimate, somewhere between 60 and 70% of the city geographically.
Oh,
And the gangs have a chokehold on commerce, so that very little commerce now flows by road from Port-au-Prince to the outlying regions. Most of the supplies that we get, we have to fly in through a charter air freight service.
oh, does that increase costs for you?
Oh, it does. Oh, yes, it does increase costs. But we have a very strong donor base, and we have good relationships with some organizations. Like there's one called Direct Relief, based in California, that does global relief work. But they have helped us several times with emergency relief funds, and they consider the situation that we're operating in now a relief emergency because it's so difficult for us to obtain supplies, through normal supply channels. And so they're
True.
helping us with that too.
I would imagine because you are a medical facility, there would be people, because of the situation in the country, there would be people coming with other kind of ailments requiring medical attention. Do you also help out with those?
Well, we can only help really to the point that something might be a life-threatening emergency. Otherwise, what we do is we will take them to the hospital to make sure that they can get care. But we're
Right.
just not equipped to manage other, health issues or health emergencies in-house.
But that could
And
be a
partly
challenge,
because,
right?
sorry?
Sorry, that could be a challenge, right? Because
Oh,
there would be
absolutely.
people.
It is a challenge. Most of the people who in our area understand, though, the difference between what we're doing and any sort of general healthcare issue. But they do come to us in times of emergency, especially when there's been a natural disaster. After the earthquake last year, quite a few people showed up needing immediate care for severe wounds. And so our staff will essentially, conduct triage and do stabilization, but then they have to move them somewhere else because the flow of patients that we're specifically addressing, can't be interrupted. When a mom shows up and she needs to deliver a baby, that baby won't wait.
Yeah, absolutely. Yeah. Right. So, Jim, tell me, how can anybody help? What kind of help do you need at the moment?
I would say, I mean, what every organization like ours needs is funding for operational expenses. But that's a very common need for organizations like ours. I mean, everyone needs funding, and actually, we are fortunate that right now we're fairly stable. I think what we need, as much as anything else at the moment, are two other things. One would be advocacy. We need help, and I don't know how others could achieve this other than with, I guess, just their voices, but we need help convincing the international community that Haiti needs help as a country. One of the things that is looming over Haiti is that the United Nations and the US and Canada and other countries are considering a military intervention. And although that would probably help to resolve the gang issue in the short term, it's not really what Haitians want, because they have a history of being invaded and occupied by forces that really are there on their own agenda, not simply there to help Haiti. And so the Haitian people themselves, in spite of the misery that they often are facing today because of the gang control of the capital city, they really don't want this intervention to happen unless it's on their terms. And so, like, I and my colleagues and friends that I have engaged in letter writing campaigns to our representatives in the government saying, please consider doing this only in cooperation with Haiti. Don't just go in with your own agenda. We don't say that specifically, but that's what we imply, that we don't want them to go in with their own agenda to stabilize the country, but not really help make a change that will allow Haiti to remain stable. And that really is the key. And that can only be done if they're doing it in cooperation with Haiti. The Haitians have to feel like, okay, you're helping us build up our systems to the point that we can be self-sustaining, as opposed to just coming in and fighting the gangs, which would be incredibly disruptive too in its own, and in the past has resulted in a lot of civilian deaths too. But then if they say, okay, it's peaceful now, and then they pull out, Haiti is left with this, aftermath of warfare, and this has happened before, and then they just have to deal with it.
And so basically funding and advocacy is what you're looking at.
Yes, absolutely. And resources. If other people know of organizations that specialize in donation of medical supplies and equipment, those are important things too. I have no doubt there are other
yes, there are multiple
organizations that we don't know about.
Absolutely. So let's get the word out there. People who can help out with resources, medical supplies, everything is welcome at Global Home Birthing Foundation. So is there any story that you remember in your 18 years of work with this organization that is particularly touching, that is memorable?
Yes. Well, there are several, but one in particular is that a young woman came in and said that she believed she was pregnant. She wasn't certain, and so she wanted to know if she could have a pregnancy test. And so they conducted the test, and yes, she was pregnant. She was very upset because she was quite young. I think she was 15 or 16.
Okay.
And wasn't ready to be a mother. And so we stepped in. I guess I should back up a step. Her background was that she came from a family where the mother had passed away. And she had a number of siblings that she had been caring for. And so when she came to us, she was really fearful because she thought, if I am going to be pregnant and have another baby, how am I going to take care of my siblings? And who's going to, care for my family? And her first thought when she found out that she was pregnant was that she should terminate it. And that is not something that we support. It didn't look like it would be a life-threatening situation. And so she was coached by the staff on how they could care for her and how we could help them. And we arranged for food to be delivered to the family. We had some of our community health promoters going out to visit to ensure that people were well, that they had access to clean water, they had enough to eat. And
You mean to say you took care of the entire family?
Yes.
Wow. Okay. Not only the pregnant girl. Okay.
Right. Yes. But, they had some resources, but they weren't sufficient. So we were really just supplementing what they had. And keeping an eye on them, making sure that they
That
always
is not
had
the
clean water and food to eat. But our staff actually became sort of collectively surrogate mothers for this young woman. She delivered a healthy girl and was very happy. And at that point, she then was confident that she wouldn't be doing all of this on her own. She had her own little built-in support group.
Support group.
Yes. And so it all worked out well in the end, and she raised a healthy girl. And I think most importantly, she was instructed on the benefits and availability of family planning so that she could control this in the future, which is something that she was completely unfamiliar with. And her mother had been unfamiliar with, which is actually she had died in childbirth.
Okay.
Most Haitian women don't have access to or don't understand the idea of having, opportunities to contraceptives. And this changes their lives. This young girl in particular, she felt empowered by this because she knew that she could control when she would get pregnant again, and it wouldn't happen until she was ready for it.
Absolutely. Yeah. Yeah. I mean, you are doing such great work getting women to understand their bodies, getting people, the society to understand the situation. Creating a healthy population is not only something that happens by chance. Some people have to work towards it to make that happen. And I'm so glad your foundation is doing that.
Well, we do what we can. I mean, we obviously what we can do is limited. That's always the case. But the most important thing that we do is we listen to the people that we consider to be in our patient community. When they come to us with a problem, with a complaint about something that happened during their care, we listen and we pay attention because we want them to feel comfortable with us. We want them to consider the center as just a part of their community, just as they would a place of worship.
Right. And what are your future plans in the next 3 to 5 years? You said you wanted to look at other areas also. Of course, Haiti is keeping you busy, but you have other areas that you want to work in?
We do. I don't see us filling the need in Haiti, though, for some time. I would say a decade or more. And that would be if everything worked out perfectly well with no issues along the way. Which
well,
is never
good luck with that.
Yes, right.
Yeah, wonderful. That's super.
But in 3 to 5 years, we do hope to open a new birth center, probably somewhere in the same general region. And I would say most likely just far enough away that it's going to be more convenient for patients to go to the new center than to come to ours, but close enough that there's a little bit of overlap. So that if there's an issue at the new center and they need help, they could access some of our staff or they could bring someone to our building.
True. Yeah.
Right.
Yeah. So I'm sure that'll happen soon. And with all the blessings and the good wishes of all the women that you've impacted, I'm sure all those will come to some kind of good luck in getting you to start that. Thank you so much, Jim, for talking to us.
It's my pleasure. Thank you.
That was Jim Grant, Executive Director of Global Birth Home Foundation, talking to us about how their nonprofit is ensuring that every woman who steps into the marvelous adventure of motherhood has a safe and healthy process. Thank you very much for joining and listening to this. See you all in yet another episode where I get to meet incredible people doing amazing work. Till then, goodbye.